Okay, go.
Okay, we are going to first start by inspecting, well, I'm going to walk in and I'm going to wash my hands. Hi, I'm Paige. I'm going to be doing your chest and lung exam today. And then I'm going to position patient probably, since we're doing it on the mannequin, I'm going to leave him here. Okay, so we're going to first start by inspecting the patient, doing quiet and deep respirations. We're going to be doing this of the anterior and posterior and lateral chest, looking at the AP versus transverse diameter, looking at the symmetry, size, shape of chest, pattern of breathing, retractions, bulging, and any use of accessory muscles. So I'm just going to have you take a few deep breaths here, and I'm going to examine, and we're going to be inspecting. Awesome. And then we are going to move on to the posterior and the lateral exam. So if I can, I'm just going to have you lean forward and cross both of your arms in front of you like this. And then I'm just going to have you stay that way until I tell you otherwise. So we're first going to palpate. Since we already inspected, we're going to now move on to palpation of the posterior and lateral chest for any tenderness. So just let me know if any of this is bothersome to you. Oh, we're moving. Awesome. And then we're going to move on to palpating the posterior chest for thoracic expansion. So what I'm going to have you do is I just want you to take in a big deep breath, putting my thumbs at about the T10 area. So big deep breath in for me. And then exhale. Perfect. Awesome. And then we are going to move on to percussing. So we are going to percuss the posterior chest and then followed by the lateral chest as well, okay? So you can just sit just normal and I'm going to percuss. This thing. Awesome. Then we're going to do the lateral chest. Okay, and now we are going to move on to the diaphragmatic excursion. So I'm going to need one of these rulers, and I need a pen. Nope. Okay, so
Soccer player.
I'm just going to have you take a big deep breath in for me, and then I want you to breathe it all the way out, and then one big breath in, and then I just want you to hold it, okay? Starting at the scapular line. Perfect. Then I will make a mark. Awesome. And then I'm going to have you breathe all the way out for me. And then I want you to take a big deep breath in for me. And then breathe it all the way out and then hold it, okay? Awesome. And then you're going to make another mark. And then you can breathe normally for me, okay? We're going to do the same on the other side. So I'm going to have you take a big deep breath in, and I want you to hold it for me again. Awesome. Okay, and then I want you to breathe all the way out for me, and then big breath in for me again, and then breathe it all the way out, and then I just want you to hold it. Okay? Oh my goodness. Okay, and then you can breathe again normally. And then this should be between 3 and 5 centimeters. Perfect. On this side, and a little shy on that one. Okay, and then that part is finished. Now we're going to move on to auscultating. So we're going to first start by auscultating the posterior chest for normal and adventitious sounds. So we are going to, I'm just going to have you just take a few deep breaths for me, okay? Big breath in, big breath out. And then again for me. And big breath in, breath out. Big breath in for me, big breath out. breath in for me. And out. Again. And again. Perfect. Okay, now we're going to do lateral chest. So we're going to go, I'm going to have you lift actually your arm up on this side for me. And same on the other side. So big breath in. And then out. And again. And again for me. And then again. Awesome. One more. And then last one. Awesome. Okay, and then we are going to move on to the posterior chest for vocal resonance, and I'm going to have patient say 99. We're going to do this for posterior and lateral chest as well, okay? So every time I move my stethoscope, would you just be able to say 99 for me?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Perfect. And then we're going to do lateral chest.
Blue balloons.
99, 99, 99, 99, 99, 99, 99, 99.
Perfect. Okay, then we are going to now move on to the anterior chest. So we are going to reposition with you. We're going to first start by palpating the anterior chest for any tenderness. So please let me know if any of this is tender for you. Nothing. Awesome. And then we're going to percuss the anterior chest as well, including the apices. Making sure you're doing the 4 main zones. Okay. And then we are going to move on to auscultating. So we are going to auscultate the anterior chest, including the apices, for normal and adventitious breath sounds. So I'm just going to have you take some deep breaths for me again. And again for me. And again for me. And last one. Okay, awesome. And then we are going to do anterior chest for vocal resonance. So we are going to have patients say 99 every time I move my stethoscope. So every time I move this, would you just be able to say 99 for me?
99, 99, 99, 99, 99, 99, 99, 99.
Awesome. Okay, now we're going to move on to the heart.
Maybe she was, I was asleep, I'm so sorry.
You're so asleep. Yep.
Okay, so I'm actually going to have you come up here.
Yeah.
Okay, and then if you'll just sit right here, and then you can like lean against that since we know we're at the heart exam. I'm going to expose the chest fully. Next, I'm going to I'll inspect the precordium with the patient sitting, leaning forward, since this is the best position for high-pitched murmurs. I'm going to inspect with tangential lighting for pulsations, lifts, heaves, and apical impulse. So I'm just going to have you breathe normal. Good. Then I'm going to palpate the apex, the left sternal border. Sorry, no, it's okay. I'm going to palpate the apex, left sternal border, and base for lifts and thrills. So, sorry, page. Apex, left sternal border, where's the name? And base. Right there. For lifts and thrills. Next, I'm going to palpate for apical impulse and point of maximal impulse. Just right over here. Okay. Next, I'm going to auscultate with the diaphragm and then the bell for rate, rhythm, S1, S2, diastole, systole, S3, S4, splitting, extra sounds, and murmurs. Starting in the aortic valve area, I'm going to listen over the right second intercostal space, right sternal border with the diaphragm, then the bell. Diaphragm, then the bell. Next, I'm going to auscultate the pulmonic valve area, the left second intercostal space, left sternal border with the diaphragm and the bell. Then I'm going to listen to the second pulmonic area at the left third intercostal space, left sternal border with the diaphragm and the bell. Next, I'm going to listen to the tricuspid valve area at the left fourth intercostal space, left sternal border with the diaphragm and the bell. Next, I'm going to listen to the mitral valve area at the left fifth intercostal space, the midclavicular line with the diaphragm and the bell. Next, I'll have the patient in the supine position. So I'm going to go ahead and have you lay down flat for me. And then I would listen in all those same areas. Next, I'm going to listen to the precordium in the left lateral recumbent, since it's the best position for low-pitched filling sounds. So I'm going to have you put your left arm up, and you're going to lay on your left side. And then I'm going to do all of that, all the same stuff. Excellent job, patient. Thank you. So now I'm going to do the vascular system. You can sit. So I'm going to palpate the pulses bilaterally for rate, rhythm, contour, and amplitude in the following areas. I'm going to feel the carotid. Not at the same time. Then I'm going to feel the brachial pulses. Brachial is next. Then I'll feel the radial pulses. And these ones came down at the same time. Good. And then I'm going to feel the popliteal space. Go ahead and lay down on your belly so that I can. Okay, sorry, Paige. Yep. Okay, I'm gonna have you bend your knee for me here. Good. Relax. Good. Okay. Now you can turn over and sit normally again. Okay, and then I'm going to palpate the posterior tibialis and the dorsalis pedis bilaterally. Sorry. I'm gonna have my patient take her shoes and socks off. Okay, and you can feel these bilaterally as well. Sometimes it's easier to feel these bilaterally as well. Good. Good. Okay, and then next I'm going to have the patient lay supine with the shoulders at a 45-degree elevation to inspect the jugular veins bilaterally. So you're just going to sit like normal, and I'm going to adjust the bed, and we're going to go back 45 degrees. Perfect.
Well, my abs are working today.
And then sometimes I actually will also have the patient kind of like look to the side, and then I'm just inspecting their external jugular here. Good. Done. Oh, bilaterally. Sorry, not done. Good. Okay, all done.